Good evening, everyone. Welcoming you all to our Well Baby Clinic evening program. I am Dr. Nimasi Anand, Specialist Ophthalmologist in Ahalya Hospital, Abu Dhabi. So today we are taking the topic, Is my child seeing normally? Which is everyone. Specialist Ophthalmologist in Ahalya. Sorry for the slight interruption. So, in this era of electronic devices, and especially with COVID, we have become so much dependent, as you all know, on these electronic devices. Not only the adults, but also the kids because of their online classes and spending more time indoors. They have become so much dependent on the electronic devices, and it has created a lot of vision problems. So, it is a concern for every parent, and they in their back of the mind they will be thinking, is my child seeing normally? So that is why I have selected this topic itself. So I will divide my talk into the following headings. So what are the common vision problems in children which we commonly encounter in the OPD? Normal vision development in a child. We have to know the normal, then only we can detect the abnormal. Then, what is the importance of the periodic vision screening and when this is done? What are the common refractive errors in children? What is this amblyopia or the lazy eye and how it can be tackled? What is squint? And for the squint, when to consult the doctor? What is the allowed screen time for the kids? How to tackle the dependence on electronic devices? And what are the corrective measures? So, one by one, I will go into. So, what are the common vision problems in the kids? The commonest one which we see in our OP department is the refractive errors. That is, refractive errors means it can be the short sight or the myopia, long sight, that is the hypermetropia and astigmatism. And the second common one is the lazy eye or the amblyopia, which is known as the amblyopia. Then squint or the strabismus, that is abnormal deviation of the eyes. These three are the commonest ones. Then rarely we see also cataract cases, especially in kids, means it is usually at birth itself or due to some infections during their prenatal period. Then the retinopathy of prematurity, which is the common, which is also a rare one. Usually we see in the preterm infants and the low birth weight infants. Then glaucoma, pediatric uveitis, and retinoblastoma. These are all very rare conditions, just mentioning only. Then coming to the refractive errors, which is the most common cause of the reduced vision in the kids. The commonest ones is the myopia or the short sight, where the child is not able to see the far object. Then hypermetropia or the long sight, where the child cannot see the near, but their distant vision will be pretty okay. And astigmatism, where the child may be complaining of blurred vision or foggy vision, or sometimes they may tell the lines appears wavy. Then second common thing is the amblyopia or the lazy eye. What is this amblyopia? The amblyopia is the poor vision which develops when there is a breakdown in how the brain and the eye work together. Normally, when a light falls in the eye, the image will fall on the retina, which is the main part of the vision. And from the retina, image will be sent to the brain and then brain interprets. So there is some miscommunication and the brain is not able to recognize the sight from one eye. So the eye becomes lazy. This is more common in squint and in high refractive errors. Then squint or the strabismus, which is the binocular misalignment of the eyes, which can be either an inward deviation, that is, eye will be turning in. That is known as the esotropia in ophthalmology term, just mentioning only, or it can be an outward deviation and parent may be recognizing from the photos or somebody may be telling them the alignment of the eye is not normal. And as age increase, at birth, sometimes this may not be present. Many parents tell like that actually. When the child was born, it was perfectly normal. But after 6 months, they noticed, mother may be telling, sometimes the eye is not in a proper position, especially when the baby is thinking of something or and as the age increases, that will increase also. Then retinopathy of prematurity, which is another vision problem which we see that is in newborns actually, especially if the baby is preterm and low birth weight, that is less than 1.5 kg. This is a thing which needs concern and has to be consulted with a retina specialist itself. And the importance of this retinopathy of prematurity or ROP is that there is increased risk for refractive errors, lazy eye, and the chance of squint also increases. Then another problem is the uveitis. That is, it is just a reaction in the eye, can be due to the infection or due to trauma and arthritis. In our OPD, it is mainly due to the trauma. That is, child may be coming with history of injury and with hand or some toy or anything, and on examination, and he may be initially slight redness may be there, and after that it may disappear. Later, after 2 days, child may be complaining of redness, difficulty looking to the light, and on examination we find it is uveitis. These are all treatable conditions and nothing to worry about. Only thing is we should be aware of these things. So what are the childhood eye problems parents should never ignore? One is the frequent blinking of the eye. If you notice your child is blinking so frequently, or he or she is rubbing his eyes, can be due to an allergy or it can be a refractive error. The child may not be seeing properly, and in his attempt to see clearly, he may be blinking or rubbing his eyes, thinking that rubbing may improve his vision. Then another common eye problem we have to is the spots on the white of the eye. Sometimes it can be a small hemorrhage, can be due to minor nail injury or anything, or it can be a normal nevus also, or it can be pale eye, which may be due to an anemia. Whatever be the condition, if you are seeing these things, definitely need to be consulted with the eye doctor. Then third is the dilated eyes. That is, this can be the dilated means the pupil appears, that central part in the round area appears little bigger. So importance is, it can be an optic nerve, hidden optic nerve problem if you are noticing. But in our dark eyes, usually we don't see this. Then the seeing floaters, the child may be complaining of seeing some black spots in front of his eye. So these things also to be shown to the eye doctor. Then another complaint is itching. Then sleeping with the eyes open. That is another problem. If it is a mild opening only, then nothing to worry about. Sometimes, if there is some eyelid abnormality, and the problem with sleeping with eyes open is the cornea is exposed and it can lead on to the erosions. Then if you are seeing crusting of eyelashes, especially on waking up from sleep, it can be a blepharitis, that is infection of the eyelid. Or if it is a newborn or less than 1 year of age, it can be a nasolacrimal duct block. That is the nasolacrimal duct, which is carrying the tears from the eyes to the nose, is blocked, which is another common thing which we find. And so that also needs proper consultation with the eye doctor. We have to find it out. and know what is the cause for the discharge and crusting of the eyelashes. Then another is, as already told, the misaligned eyes, which is the squint, which can lead on to the amblyopia. Then another problem we have to look into is head tilt. That is, child may be bending his head to a particular direction, especially while watching TV. And that is because that is one common thing which we see in case of astigmatism, as I have already mentioned, which is a refractive error. So in that particular head position, his vision is clear and he is maintaining that posture. Another is poor school performance. We may be unnecessarily blaming the kid. Poor kid, he may not be seeing properly, which may be the cause for the poor school performance. If any of these problems you are seeing in your kid, please consult an eye doctor. And these are the 4 hidden signs of vision problem in the children. That is, having a short attention span, which is another thing which we see. The child may be hyperactive, and this hyperactivity may be not due to any other cause, but maybe due to the poor vision. So before blaming the child as hyperactive, make sure his vision is normal, because he may not be seeing clearly, and which is causing irritation to him. And while reading, actually losing the places, especially while reading the textbooks, he may miss the lines, he may miss the words. So in that case also, parents should bring the child to test the vision. And sometimes the child may avoid reading and other close activities. That may be also a underlying vision problem. And as previously mentioned, they are turning their head to one side, which may be the cause for an astigmatism, which may be the underlying cause, may be the astigmatism, which needs to be corrected. So if any of these signs which we are seeing in our kids, please bring them to our department. So these are the points which we have to take care. Then just I want to mention about few lines regarding the normal vision development in the kids, especially starting from the newborn. So as the child is born, he can see clearly, and his vision starts to develop slowly. By the end of the first month, the central vision will be developing, and few connections are made between the retina and the brain, and the child starts to see. And in the first month, he begins to focus on things. Not all things, but sometimes he will try to focus on the things. That is, focusing starts developing from the first month. Then during the second and the third month, the connections becomes more well developed, and he starts following and focusing the objects more specifically. And he points to, he looks at the complex design patterns of the colors during the second and the third month. So after third month also, if the child is not following the light or not fixing means, then it needs consultation. Show to a pediatrician first, and he or she will examine, and then if needed, will refer to the ophthalmologist. Then by the fourth month, the three-dimensional view begins to appear. That is the beginning of the depth perception. So the child assess the things better, and hand-eye coordination also will become better. Then during the fifth month, the depth perception becomes more and more well developed, and the baby recognizes the moving objects that are small and close to his eyes. By 8th month, the vision is almost well developed, and it is almost similar to that of an adult. And he or she will be able to see the objects clearly with good depth perception. And between the 9th and 12th month, they can judge the height, distance all pretty well, and they will grasp the objects, and the hand-eye coordination develops well. So if the focusing is not there, fixing and following is not there, depth perception is not there, means if any abnormality you are finding in your kid, please show to the pediatrician, and they will assess and then will refer. And as the child grows, they will around the after 1 year, 1 to 2 years, they start matching the similar objects. So that sort of toys we can give to them. Then 2 to 3 years, they respond to the command, start counting, all these things. And by 3 to 5 years, they start drawing pictures, describe the recognizable pictures, everything. And by 5 to 7 years, they start learning sort objects by similar characteristics. These are the few vision milestones in the kids. So what we are doing on examination of the kid is at the up to 2 months, we will just examine the child. And the main thing we assess is whether the child is blinking to the light. By 2 to 3 months, as I have already told, the child fixes and follows the light. 3 months to 3 years, they develop a central, steady and maintained vision. By after 3 years, that is around 4 to 5 years, we can easily assess the vision by the letter charts and the picture chart. Actually, we do it with the picture chart, and we can have a rough assessment of the vision. Before that, also, we can assess the vision by our auto refraction and dilatation testing. But if any abnormality is we detect, we will do the testing with the by putting the drops, and we can have the correct assessment of the vision. But rough assessment can be taken with this. And 5 to 6 years, we can do the letter, the child can read the letter chart, and around 6 to 7 years, the normal Snellen chart. That is like we test in the adults, they will read normally. So during the vision development, we parents also have the role. So we have to do activities that will help in the development of the normal development of the vision. That is, the kids enjoy playing peekaboo, then hang some colorful articles in front of the crib and they will look at it. Just use the mirrors to show their reflections. Take them out for a walk or a drive and let them notice their surroundings. Can give the bright colored objects in front of the baby and encourage them to take it. And when the baby is sleeping, you can keep a dim light so that the babies can see around the room, and let their eyes follow a particular thing or your finger, and let them follow your voice. So we as parents can do many activities that will help in the vision development. So that is about the problems and the normal vision development. Now coming to the vision screening, periodic vision screening. The importance of periodic vision screening is, if any problem is identified early, so we can institute the appropriate treatment. So the early vision screening will help in the early recognition of eye problems. And in the kids, actually, since they are developing, we can mold their vision. That is, if any problem is identified, we can give them the corrective spectacles and can improve the vision. So when we are examining the child, we ask about the history. In the history, we usually ask about the birth weight of the baby, the preterm or term baby, and whether the baby has achieved the normal milestones. And in the family history, any family history of any eye problems are there. And if it is a bigger kid, we ask about the school performance and any associated illnesses, which can all give clues to the any underlying vision problem, which will be easier to identify. So vision screening can be done by the pediatrician, ophthalmologist, a trained healthcare provider, or a family physician. Now here in Abu Dhabi, in UAE, actually we have all the schools having their school eye screening tests, which are conducted by their trained healthcare providers or various hospitals conducting the routine vision screening, which has helped us a lot in picking up so much of refractive errors in our kids. And if any problem is identified, they need a comprehensive eye examination. And here we follow the American Academy of Ophthalmology guidelines in prescribing glasses, everything. What the child should wear, at what age, and what powers are decided by we follow the American Academy of Ophthalmology guidelines. So what is the recommended schedule for child vision screening? When a child is born, the doctor will check the red reflex. So you also should know what we are examining actually. That is why I'm telling this. The doctor will check for the red reflex. Red reflex means when you show the torchlight to the child eye, at the center we can see a red color, which means the redness that we see is the retina, the light reflected from the retina. So if any opacity is there in that pathway, that reflex will not be seen, which will be a hidden clue for the cataract. And as I have previously mentioned about the retinoblastoma, which is an intraocular tumor actually. These things can be easily picked up by this simple torchlight test, that is the red reflex test. Then we show the light. If the child is blinking, means at least we can have a rough assessment that the child is seeing the light, and also the reaction of the pupil, which also shows the that the optic nerve is normal or not. That is, optic nerve means the nerve of the eye is normal or not. That is usually done by the pediatrician. And if any abnormality is there, the pediatrician will definitely refer for the eye examination. And these are the, if it is a normal baby, means this is enough. But ophthalmology checkup is mandatory if the baby is born preterm, has signs of any eye diseases, that is at birth itself you are seeing a white reflex, the abnormal position of the eye, any discoloration of the eye, or any family history of any eye disease is there. And also at one point mother is having any history of fever or any other illnesses during the pregnancy, also ophthalmology checkup is mandatory. That is regarding the newborn. Then at the age of 6 to 12 months, that is the second screening, which is also done by the pediatrician, where they check for the red reflex, blink test, and pupillary response. And in this stage, the child has started fixing, following, and depth perception all have developed. So we can assess the movement of the eye and alignment of the eyes. And if any squint is there, that also can be picked up during the stage. Then the third screening is after 1 year, that is 12 to 36 months. That is the period for the third screening, where above tests are again repeated. Then the next screening, 3 to 5 years, where we test for the vision using the picture chart, alignment of the eyes, and if any problem is identified, then we advise the ophthalmology consultation. That is, any refractive errors, squint, lazy eye is the ophthalmology evaluation is mandatory. And 5 years and older, every year we should just check, do a routine checkup of the vision, and we can pick up the many refractive errors. So this is the chart which shows the what are we testing actually in the child. That is the red reflex test, whether it is absent or present, external inspection of the eyelids, any lid problem is there, any ptosis. Ptosis means that is the eye is drooping actually. All these things. Then pupil examination, child is fixing or following, squint evaluation, cover testing, all these we are doing in the child. So if any problem is identified, we will refer to the ophthalmology. That is where we do the comprehensive eye examination. So you will be bringing your kit, and we will, what all things, that also you should also know what we are assessing. That is, it is not only the vision we are assessing, but we check for the red reflex, then vision evaluation, and look for any squint is there. We check the visual fields. Pupil examination is done. That is, with the torchlight or with the slit lamp examination, we can assess the pupil, which clearly shows the optic nerve function. And external examination, any ptosis is there, any lid abnormality, lid swellings, that is there. And if any vision problem is identified, then we will advise the refraction testing by putting the drops. That is, we will be putting the drops. The child will have to sit for 1.5 to 2 hours. After that, the eye muscles will be relaxed, and we will get the full power of the eye. And then we will take a reading. And after this 3 days, there will be blurring of the vision. After 3 days, then we will tell the parent to bring the child again, and we will give the, depending upon the reading, we will give the correct glass prescription. That is, we will give the minimum power which gives the best correction is prescribed. And during that refraction testing, we will examine the retina also and make sure retina is normal. And if the child is prescribed glasses, then every 6 months we have to bring the child for the repeat examination. So, if everything is normal, only yearly follow-up is needed. As I have already told, if a refractive error is present, suitable spectacles are prescribed, and we will advise the parents to bring the child after 6 months, because as the child is growing, the power can change actually. And if the lazy eye is detected, occlusion therapy will be advised. The details I will come in the coming slides. And if a squint is detected, that is misalignment is detected, we refer to the pediatric ophthalmologist, because the squint can be, all squints doesn't need surgery. Some squint or the misalignment can be due to a change in the power of the eye, which can be corrected with spectacles. And those that cannot be corrected with spectacles only need surgery. And when to do the surgery, how long we can wait, that all has to be decided by the pediatric ophthalmologist. Then I will deal with all the common problems one by one. The refractive errors in children, which are the commonest one, of which the commonest is the myopia or the short sight, where the child cannot see the distance. So these are mainly picked up by their teachers actually, or sometimes the parents also say the child is watching the TV so closer. Sometimes the teacher may be telling when the child is sitting in backbench, he is not able to write the notes properly. So that distance vision is blurred. But child can see well for reading and the near vision task. And we will prescribe the glasses, and we prescribe the minus glasses actually for the myopia or the short sight. The prescription is given after the cyclorefraction and retinoscopy testing. Then hypermetropia, which is actually less common. It is the long-sightedness, that is, the child cannot see the near things clearly. Distant vision is good. Most of the kids are actually far-sighted early in their life, and they will focus with eye muscles to see clearly. But when large powers are present, that focusing muscles are not able to keep the vision clearly, and then there will be problem. That cases we need to prescribe, and that we are giving the plus glasses. Then astigmatism. It is due to the difference in the surface curvature of the eye, that is the corneal surface irregularity is causing this astigmatism. So the fine details will be blurred or distorted. In this, we see the child having a head tilt, because in that particular axis, the child will be having the better vision. So he's tilting his head into that axis so that his vision is clear. For this, we prescribe the cylindrical lenses. They are having power in one axis. Then another is anisometropia, that is a difference in the power in each eye. That is, one eye may be having some minus 0.5 only, the other eye having minus 2.5. And in some cases, one eye may be normal actually, the other eye having minus 3 or 4. This is usually at birth itself, the eye is like that. But the problem with this inequality in power is there is high risk for amblyopia. And some cases can go for the squinting, because since we have both the eyes, since the child is able to see with one eye only, the brain will interpret the image from one eye only, and the blurred image from the other eye will be suppressed by the brain. So that can lead on to the amblyopia. So that is the importance of anisometropia, and early detection will help in preventing the lazy eye. So these are the few guidelines for the refractive corrections in infants and young children. The main concern for the parent is when the child is very small and we are seeing a power. This we are following according to the American Academy of Ophthalmology guidelines. When the child is very small, not all cases we prescribe the glasses, especially infants up to infants and until 4 years actually. So depending upon the power actually. Especially high myopes only, we prescribe glasses. Depending on that is, if it is less than, maybe less than 1 year, 5 diopter or more only we prescribe. That is this is just a chart showing the power. And astigmatism actually, Even with small powers also, we prescribe glasses because they have high incidence for amblyopia. To prevent the lazy eye, actually, we are prescribing. And if the child is having the without squint means, but inequality in power means early prescription is needed. Then these are the few questions which many of you will be having in your mind. How will I ever get my child to wear glasses? That is, if the many young children actually who really need glasses, where the parent may be asking doctor whether he or she will wear glasses. So I usually tell, if the child can see clearly and he definitely need glasses means he will wear it comfortably. And especially after during the next visit, after a 6-month visit, they will tell. The first thing when they get up from the bed is to ask for the glasses because now he knows this is his good vision. So those who really need glasses will wear it comfortably because that they know that is the good vision. But still, some kids may resist actually. They are small, no? We cannot blame them also. In that cases, parents be patient and try them when they are in their good mood and make them understand that is the good vision actually. And once they are used to that clear vision, they will continue wearing the glasses. And another question is, does my child need bifocals? Bifocals, very rarely we give in children. Bifocals are usually given when the age is above 40. Now these bifocals have been replaced by our progressive glasses also. But in mainly two conditions, kids need bifocals, especially in eyes with squinting actually. One type of squinting, as I previously mentioned, no, some types of squinting are due to the power in the eye, especially for the near eye goes for the squinting. In that case, we give the bifocals. And also when the child had cataract surgery, that is congenital cataracts, in that case also we give the bifocals. Very few cases only we give. Otherwise, it is the monofocal lenses, that is single vision lenses only we prescribe. And another common question is, will wearing glasses make my child's eye worse? Or whether he or she will become more dependent on them? No, it is not like that at all. Just the opposite is true. That is, if the child is not wearing glasses, the normal vision development is affected actually. And the eye is not getting worse actually. The vision is improving. So, what are the points to note while selecting glasses for the kids? Always select a good frame actually, and make sure the eye should be centered in the middle of the lens. That is, child should not look above the glasses. That parent should be take care well. And the best material is polycarbonate because it will not break. And some frames are having some soft comfort cables actually that may fit around the ears so that it will sit in the correct posture. And add a strap or a silicone temple tip so the glasses are kept in the correct position. And majority of the kids will adjust to their glasses within 2 weeks. So initially, I will tell them if it is they are starting to wear, and if they are very small, then I tell them at least make sure they are wearing glasses minimum 4 hours in a day. And if they are wearing it all the time, means it is well and good. Otherwise, don't compel them. Give them some time. 4 hours in a day is fine. And after that, they may get adjusted to the vision, and then they will continue wearing glasses. Some usually within 2 weeks they will get adjusted. Can wait for up to 1 month also. If still not comfortable only, then you visit the eye doctor again and also check the glass power, alignment, everything. Otherwise, majority of kids will adjust to their glasses well. Then, if they are not wearing the glasses properly, there is the increased risk for the amblyopia or the lazy eye. And then a few points about the amblyopia or the lazy eye. Amblyopia or the lazy eye, nothing to worry about. If you start the treatment early, I can confidently tell we can get 100% normal vision. That is, what is the principle of this occlusion therapy? That is, as I have already told you, one eye is already weak and the image from the child is suppressed by the brain. So that weaker eye should be made stronger. So we are by the occlusion therapy, what we are doing is we are occluding the normal eye. So the child is made to use the weaker eye. Slowly, and weaker eye and with the corrective glasses. So child is thus forced to use the weaker eye. And this can be done, occlusion can be done with the patching. This is one form of patch actually, which is stick to the eye above the eye itself. But this we usually use for the squinting actually. But with the glasses actually, this one is much better. That is the patch that is fitted onto the glasses. That is, patch is placed over the better eye to make the child use and develop the good vision in the lazy eye. Then how long we have to, that is decided by the ophthalmologist itself. So, majority of cases, I usually advise 4 hours patching. And during the 4 hours of, for example, if your right eye is weak, right eye vision is not normal, left eye is having good vision. So, left eye we will patch. And we are then told to use the child is advised to use the right eye 4 hours a day. But initially you can make it 2 to 3 hours, and that time engage the child in the near vision activities. That is, don't do the patching for while they are studying actually. Then they can draw, paint, can make the Lego blocks. Half an hour they can watch TV. In that way, you can make multiple activities for the patching. I usually tell them don't do the patching while you are making them sit and study actually. If they are okay with that, is well and good. Otherwise, this one is better. Okay. And keep a book actually. And then for drawing book. So I usually tell them after 6 months, you please bring that book so that I can also see how much you have painted. So the child also will be much interested. And offer them small presents, not always, once in a while. Yeah, you have done patching. So, and if you do patching in the early ages means we can fully guarantee the 6/6 vision. Then if the child is so much resistant to patching and if small babies, then we use the drops actually, atropine, which is placed in the better seeing daily. So that image will be blurred and they will use the lazy eye. That is the principle of the patching. And depending on the improvement in the vision, after 6 month follow-up, usually I call the patient after 3 months if I advise patching. And after 3 months, we will assess the vision. If there is 1 line improvement means that is definitely good sign. Then we'll tell continue patching for 3 more months. 2 line improvement means then after 3 months, we will reduce the duration to 3 hours. Then depending upon that improvement, we will reduce. And after 6 months to 1 year, we can, if the vision is improving to 6/6, then no need of patching at all. Then another thing is that is about that vision spectacle patching part again. Now as parents, we should find time to play with the kids. Actually to slightly withdraw them from the electronic gadgets actually. We can play with them, both, especially when they are small. When they are big means they will have a lot to study. They will have, so this when they are small only, we are able to play with them actually. Don't waste that time. So somehow you find time to sit with the kids and play with them. During the COVID time, we were actually stuck at home that time and full with online classes also. Now it is the situation is much better actually, and can even in indoors also we can play board games with them, support them with Lego blocks. I'm telling these things just because these are all, they will help them to improve their fine skills as well as logic, thinking. Those things also will improve along with that. Painting, drawing, reading books, and also encouraging outdoor games. It is ideally, it is told minimum 11 hours outdoor activities are needed in a week. I don't know how much as working parents we will be able to do this, but still the ideal recommendation is 11 hours outdoor activities for preventing the progression of myopia. And regarding the screen time for children less than 2 years, there's a 0 screen time. AAO is telling no screen time actually. For the elder kids, 60 to 90 minutes is the maximum screen time allowed. These are all the few tips to. And now and as you have already seen, there is higher increase in the incidence of myopia, and the myopia is also progressing. So one drop that is in addition to the spectacle is atropine eye drops, which is in very low dose, which is found to lower the progression of myopia. So this is the screen time actually. For pre-primary, only half an hour is allowed actually. And for first grade to 8th grade, around 45, that is around 1.5 hours screen time. And for the higher grade students, maximum 3 hours. But definitely I know this is much, definitely with online classes, everything, this will be much more than that. But one thing we can do is you reduce the other near vision, not reduce actually, stop the use of the mobiles. And these online classes, now it is not online, but many are having the tuitions, everything online. Those cases we cannot avoid. And only those things you make it, and stop the use of the other near vision gadgets. Because now so many studies are coming up which shows the association between near vision acuity and the near visual acuity activities and incident myopia in the children. And it is shown that high increase in the near visual activities, that is the use of this near vision gadgets, have lead to the higher increase in myopia in children. Even from our experience also, that is since last 2 years we were stuck at home with online classes, everything. And after that, when they started coming to our OPD, we were also surprised to see so much cases of myopia were there. And that too, it is not -1 or -2 powers, -4, -5. We were also surprised to see. Here we are not conducting any studies, but even from our experience also we can tell that once you stop using these near vision gadgets, during the next visit, majority will stop, majority cases of myopia will stop progressing. Even no need of atropine also. More time outdoors will lower the child's risk for myopia. So a study has looked at kids, and they're telling 40 extra minutes outdoors each day has markedly reduced the risk of getting myopia or more severe myopia, and has reduced the progression of myopia. And the kids who are spending more time indoors were more likely to get myopia. So how to protect the children's eye during the screen time? Because in this era, actually, some amount of screen time is we cannot avoid also. So you follow the simple 5-step strategy of blink 20-20-20. That is blink, that B stands for the blinking actually. Frequently blink the eye, that is moisturizes the eye. During the blinking, our tear film will coat over the surface of the cornea. That will reduce the symptom of the dryness. And after 20 minutes screen time, you advise the child to look at an object 20 feet away for 20 seconds while blinking, and relax, and that will relax the shoulder and the neck muscles also. Then L stands for the lubrication. Yeah, it is. If the child is having symptoms of dry eye, lubricate with the artificial tears. Then the screen, keep the computer or the desk an arm's length away and at a slight downward angle from your child's face. Adjust the contrast and the brightness, maintain a good posture, and avoid the glare on the screen. Another thing I usually suggest, especially those with progressive myopia, is you connect, especially for the online classes, you connect the laptop screen to the TV using an HDMI cable so that they are at a distance they are seeing. So it is not the near vision uses. That much we can minimize actually. Then near device breaks are a must actually. That is, encourage your children to go outside. You also go out with them, either play with a pet or the sibling or any non-electronic toys when taking break from the online classes. Even many parents complaining once online classes are stopped, they will switch over to the next device in that way. So don't go for the device during the breaks and can look out of the window or for about 20 seconds. And also rely on the eye health information from trusted sources, including your child's pediatrician, ophthalmologist, or the AAO guidelines. And there is regarding the no regarding the blue light. Actually, there is actually no scientific evidence that light coming from the computer screen is damaging to the eyes. So the academy does not recommend blue light glasses. But now so many are suggesting that is if the child is having normal vision, 6 vision, there is no need of glasses at all. Only if the child or even the adult person having a refractive error, he needs to wear glasses. Otherwise, simple plano with blue light is not going to help him at all. The symptoms which he is having, that is the dryness, burning sensation, eye pain, everything, are not due to the harmful effect of blue light, but it is a part of computer vision syndrome. Here, the blue light has no role. So, that is a part of computer vision syndrome. For that, you follow the 20-20-20 rule. That is, after 20 minutes, switch to 20 seconds, look at 20 feet at a for 20 seconds. Then use the lubricating drops. Keep the screen at the correct time and take the proper breaks. This will relieve. Rather than no point in wearing the simple plain glasses with blue light filters. But if you are having the refractive error, means you can wear the glasses. So these are the 7 tricks to limit the screen time. That is dimmer setting to be done in the device. A device cap time, follow the 20-20 rule. Schedule the free play time, which are just summing up what all I have already told. Social interactions, gadget-free weekends, and audio entertainment. As parents also, we have to also do the same thing. I have seen in my OPD also, I have seen so many parents coming with the kids. One may be talking to me and the other parent may be busy with the mobiles. They only learn from their parents actually. So we also have to limit the use of these gadgets. Then only we can also advise them. What about food actually? Food, healthy food, as you already know. Food rich in vitamin A, beta carotene, vitamin C, all are helpful to the eyes actually, like carrot, salmon, omega-3 fatty acids, nuts, green leafy vegetables, broccoli, strawberry, all healthy food. So the take-home message is periodic vision screening for the kid is a must. The refractive errors identified has to be corrected with suitable spectacles. Promote the outdoor activities. And requesting parents, you find time to play with your kids and reduce the screen time. So thank you. And these are my few references. So now you can ask any questions if you are having any doubt, any clarifications needed. I'm so happy to answer. Any questions? No problem. You can ask me. Any doubts?
Hello, ma'am.
Yes, please tell.
Ma'am, many parents are asking whether need to wear the glasses while using the computer while reading for the kids, even they are having myopia.
Yeah, it is better actually. If they are having the refractive error, then they have to use the glasses.
Like if they are having high myopia, of course they can see the near vision clearly without glasses also close distance. So the parents' question is that whether they need to wear the glasses or without glasses they can read properly.
No. For the proper ocular development, if you are having a refractive error, even though they can see clearly, it is better we advise them to use the glasses, especially during the developing stage. It is better to use the glasses while using the screen.
Okay, ma'am. Thank you, ma'am.
Okay. Any questions? If no more questions, we can conclude the session. And if any of you are having any problems, you are always welcome to our department. We will try to solve your child's issues. Okay. So thank you.